Good afternoon. Folks are still coming in. We're going to get started in just a second here. Welcome to today's event and thank you for joining us. A couple of housekeeping notes. We do encourage you to connect and chat with us through the Q&A function on your screen. If you have questions or insights throughout the event, feel free to drop them in the chat and we will do our best to incorporate them in the Q&A at the end of the event. As a reminder, I also want to let you know that this event is being recorded, and for our panelists, please mute your microphones when you are not speaking. We are very thrilled to have a full event for you here today. So thank you for joining 1,000 Days, Bread for the World, and Interaction for the Looming Threat of Malnutrition in the COVID-19 Pandemic. I'm Jenny Marron. I'm the Director of Public Policy for Interaction. And for those that don't know Interaction, we're the largest alliance of US-based NGOs working in development and humanitarian programs around the world. And we're here today to hear from nutrition and food security experts on how COVID-19 is impacting global nutrition and food security and what solutions and actions Congress and the Biden administration can take. Now, while we have made progress toward eliminating global hunger, there is still great need around the world for food security assistance. After nearly a decade in decline, hunger levels are rising due to persistent challenges of conflict and climate change. And this is the year to take action. As the Biden administration looks for opportunities for the US government to take global leadership, there are several upcoming multilateral summits where US leadership and commitment can change the course. Just to note a few of those, the UN Food Systems Summit this fall, the Nutrition for Growth Summit in December, will both be global opportunities for the US to help lead and commit to build healthier, more nutritious, sustainable, and equitable food systems. The G7 and G20 summits also have a food security focus this year. So those are really critical opportunities. But the most urgent step that the administration and Congress can take right now to combat global food insecurity and malnutrition is ensure robust funding for the international response for COVID-19. The NGO community is asking for $20 billion in supplemental funds to combat the health and related effects of the COVID-19 crisis. And you will hear here today just how important these funds are and what needs to be done to combat malnutrition. COVID-19 pandemic is worsening the global poverty, food insecurity, and malnutrition rates overall. In 2020 alone, it was responsible for nearly 100 million additional people falling into extreme poverty. Pandemic-related disruptions to food and health systems have led to a devastating rise in malnutrition rates around the world. The number of people facing crisis level of food insecurity more than doubled in 2020. So we're talking about an estimated 271 million people. And as long as these disruptions continue, millions more children will suffer from severe malnutrition every year. In many parts of the world, malnutrition related to the pandemic is projected to kill more people than the pandemic itself. So as you can see, the needs are urgent. This is the right time to be talking about this topic, and we're going to dive in with a full slate of speakers to tell you more. We are very lucky to start today's event by hearing from one of the strongest congressional advocates to ending malnutrition and food insecurity, Representative Jim McGovern. First elected to Congress in 1996, Jim has fought tirelessly for the people of Massachusetts and has earned the respect and trust of his colleagues. He is the chairman on the House Rules Committee, senior member of the House Committee on the Agriculture Subcommittee on Nutrition and Oversight, and the co-chair of the House Hunger Caucus, which investigates and educates on national and international hunger and food insecurity issues. So with that, let me turn it over to hear some remarks from Representative McGovern.
I want to thank Interaction, Bread for the World, and 1,000 Days for sponsoring this timely discussion on the global threat of malnutrition and the critical importance of investing in nutrition now, not later. I'm grateful that we're taking the time to talk about this. We know that each day we fail to focus on the threat of malnutrition, That means another child will grow up stunted. A mother will give birth to a malnourished baby. An adolescent will be unable to learn. A young person will be too tired to work, and a family and community will have a diminished future. 4 years ago, we were so optimistic. We had made such progress and had plans to do even more. Then we started seeing an alarming rise in hunger and food insecurity due to climate change, an onslaught of natural disasters, conflict, and war. I believe one of our next speakers is going to describe the situation in Yemen, one of the worst humanitarian crises in the world. We were determined not to lose ground, not to lose the progress that we had achieved. But then came 2020, a year none of us could have predicted, a year that none of us can forget, its impact on our nation, its impact on the world. There's not one single aspect of our development agenda that hasn't been adversely affected by the COVID-19 pandemic, and that includes shattered food systems and agriculture, and a frightening explosion in hunger, food insecurity, undernutrition, and malnutrition. Clearly, we must all step up in ways that we never imagined. Perhaps that's our first challenge. We must reimagine in ways large and small how we're going to advance nutrition and support maternal and child health, ensure school-aged children receive nutritious meals when schools are shuttered, support small farmers, especially women, and strengthen food systems in ways that support families and local communities. This is work that cannot wait, cannot be put off, cannot be placed at the end of the line. In 2019, before the pandemic, 47 million children already suffered from wasting, and 144 million children under 5 were already stunted. Last July, UNICEF estimated that an additional 6.7 million children under 5 could suffer from wasting in 2020. Another 190 million boys and girls aged 5 to 19 are highly vulnerable to nutrition shocks. In a just-released UNICEF report, we find that last year, in 2020, because of school closures, an estimated 39 billion in-school meals were missed by the 370 million children who normally benefit from school feeding programs. I remember visiting a McGovern-Dole program at an elementary school on the edges of the Kibera slum in Nairobi, Kenya. I sat at a table sharing with the kids a meal of what looked like hot mush. The little boy sitting next to me kept glancing around, and then he'd scoop out handfuls of his mush and stuff it into his pockets, several times in a row. When I asked the principal about it later, she told me that he was taking food home to his younger siblings. Well, that boy is a young man now, and I wonder how he and his family are surviving these difficult times. I worry about today's boys and girls and their brothers and sisters who no longer receive nutritious meals in schools. I worry about the mothers and infants who aren't receiving specially tailored food and resources to keep healthy and nourished during these difficult times. And I worry about young girls and boys trapped at home, unable to go to school, who lack food, face abuse, have no support, and who may even be forced into marriage or other violent and exploitive situations. I worry, but we can respond. We know the level of resources required from the United States and other nations to keep the crisis of malnutrition and food insecurity from getting worse. And we know that we must begin laying the groundwork now for recovery. Now, I know the professionals at USAID, the CDC, and the State Department, they know this. They understand the problem and the chaos that could arise in the future from failing to aggressively address these crises now. I have great hope that the Biden administration understands that global health and food security, including nutrition, are priorities when dealing with the pandemic today and planning for tomorrow's recovery. The challenge is making sure that Congress and the American people understand that these investments are in the best interest of all of us. While the overwhelming amount of U.S. funds will always go to the American people first, we can and we must provide the necessary resources to address the worst effects of the global pandemic. It is the right thing to do. It is the smart thing to do. We must act now, not later. Together. Thank you.
Well, thank you so much, Representative McGovern, for those great remarks and that call to action. Next, we have the opportunity to see a snapshot of the realities of malnutrition. We're going to see now a clip from The Hunger Ward, which is a documentary that tells the stories from inside two of the most active therapeutic feeding centers in Yemen. As a warning, some viewers may find this content disturbing. But following the video, we will hear from the director, Skye Fitzgerald, about this documentary and his broader work to tell stories of hunger.
بس لا تمام بس هذا شوية يعني تمام بطنه كبير ما ياكل ما اكل حقه ما ياكل سوء التغذية الحاد الوخيم نتيجة فقر تغذوي بالدرجة الأولى. أنا لو سألت الأم دحين ليش ما تأكلي طفلك وما أكله سنتين رضعي تقول لك ما فيش حليب ما يهب له علاج. خمس سنوات من الحرب أكلت الأخضر واليابس اللي كان يتسبب فيها الناس ومن ضمنهم المجتمع المضيف حق أسلام. سوء التغذية موجودة بس كانت بحالات مش زي اليوم حالات بسيطة. فما تتوقع يعني تتوقع انه مزيد من الحرب مزيد من سوء التغذية. ما فيش تخاف مكان نحن سوء التغذية. كل شوي ودخل واحد وخرج واحد لو انا اشي استقبلهم كلهم املي الغرف. مهنة شمولية بحيث انه اللي يمسك القطاع الصحي يكون كل افراد المجتمع اسرته. أمام الإنسان دور كبير إنه يؤديه. لا نكونش إحنا والحياة المعيشية فوق هذا الطفل. يفكر على إنه ربما إنه إذا استمرت الحرب نفقد كل الأطفال.
So that's an incredibly intense video clip that shows just how dire the situation is. And now we're going to have a chance to hear directly from Skye Fitzgerald about making doing this work. Skye is the director of the Hunger Ward, which you just saw a clip of, and he's founded Spin Film to bear witness to unfolding crises with the intent to deepen empathy and understanding. He directed a trilogy of films on the global refugee crisis. The third movie in that series is The Hunger Ward, which we just saw a bit of, talking about the war and famine in Yemen and the impact on children, families, and healthcare workers. I'm turning it now to remarks from Skye.
Hi, I'm a filmmaker and Fulbright scholar. I spent a month in Yemen in January and February of 2020, embedded in 2 clinics, therapeutic feeding centers that specialize in cases of SAMs. Now, there's a lot of terms thrown around in this specialized field of pediatric nutrition: SAMs, MAMs, RUTF, TFC. But let's be plain. It's really about one thing: starvation, right now. Within 2 hours of our arrival in our first therapeutic feeding center, a child died in front of us, not of disease, not of injury, but from complications from starvation, from lack of food, from the mother's inability to provide resources while in the womb for proper development, breast milk after birth, and appropriate formula she developed. And then another child died, and another. It's one thing to read about children experiencing hunger. It's another to watch child after child die of starvation in front of you. This is what we saw and bore witness to in Yemen during our month there. Your politics on Yemen don't really matter in this instance. What matters is getting proper nutrition to children who are dying of starvation as I speak these words. Now, there's a word that the large INGOs are scared of: famine. Famine by UN definition is that at least 20% of households in an area face extreme food shortages with limited ability to cope. The prevalence of acute malnutrition in children exceeds 30%, and the death rate exceeds 2 people per 10,000 per day. This is happening. I saw it with my own eyes, and I hear it anecdotally from colleagues in Yemen now. Because of the war, though, and the UN will likely admit this, they can't get accurate statistics because of tensions between warring parties. That doesn't change the facts on the ground, though. I often think back to 1994 in Rwanda, when we allowed uncertainty about conditions on the ground to cloud our global judgment about whether we should intervene, and hundreds of thousands died unnecessarily. There is no uncertainty about what is happening in Yemen. Tens of thousands of children are dying for lack of food, and we can change that by funding nutrition programs. I'm in contact with Dr. Aida Al-Sadiq, the premier expert on pediatric severe acute malnutrition in Yemen. And every week, she sends me photos of children that are being treated at Sadaka Hospital in Aden. And as difficult as it was to bear witness then, conditions are worse now. COVID has challenged their efforts in significant ways, and the dip in funding from the US during the last half of 2020 forced them to let go of several staff members, some of the only highly trained pediatric specialists in the country, in a feeding center that receives more patients than anywhere in the country. This is the current state of things, and you can change it. I challenge anyone to watch a child die of hunger and know you can do something about it and not act. Personally, I choose each project I do using simple criteria. If I were to pass away today, would I be proud of the work I leave behind, and was it in the service of others? You, right now, are in a unique position. You can save a child's life. I hope you choose to fund global nutrition in the American Rescue Plan. It's desperately needed, and it will save lives. In solidarity.
Thank you so much for those remarks, Skye. And I think we're all understanding the urgency of the situation. Our next speakers are going to give us a little bit more context and tell us the other opportunities we have and how we can make a difference, and the solutions that we have at our fingertips. We know how to address these problems. And so I'm going to turn to Karin Lapping now, who is a PhD and MPH and is also the technical director at FHI Solutions, which is the nutrition subsidiary of FHI 360. She's a public health nutritionist, has spent the past 25 years working in international health, primarily with non-governmental organizations. Her professional academic focus has been on the prevention of chronic malnutrition throughout Asia and Africa, and she is going to provide us some more context here now. So let me turn it over to Karin.
Thank you so much, Jenny, and thank you to Interaction Bread for the World and 1,000 Days for organizing this event. I'm really pleased to join you all. I couldn't set this up better than what Congressman McGovern and Skye Fitzgerald have already presented. But to give it a bit more context, I'll just speak for a few minutes about malnutrition and the impacts of the COVID-19 pandemic. What we saw from the Yemen video was an example of wasting, or a child being too thin for their height. Recent projections based on the impacts of COVID-19 are showing that by 2022, an additional 9.3 million children will suffer from the condition that we saw in the video. This condition means that a child is 11 times more likely to die than their well-nourished peers. Yemen should never happen. We have at our disposal preventative actions to prevent Yemen. We know what to do in the nutrition community, in the health community, and the global development community, and that's what we need to do. So we'll talk a little bit more about that and some of what we can do and the opportunities along with the COVID-19 impacts. The sort of malnutrition that we saw in Yemen doesn't just exist in acute emergency situations. Unfortunately, it exists in development settings as well. It is a manifestation of malnutrition that, as I mentioned, is quite linked to mortality. But there are also other manifestations of malnutrition that are often more invisible, but also have lifelong impacts. We know that good nutrition saves children lives. It gives them the chance to thrive. It is critical for children to grow, develop physically, mentally, stay healthy, and learn. So what causes malnutrition? At its most basic level, malnutrition is caused by inadequate intake, so basically what one's putting in their mouths, and an interaction or a synergy with potential disease. So what that really means is just because we are fed something doesn't mean that our bodies can absorb it if we have some sort of other illness like worms or diarrhea. So it's not just enough to get to the food to the child, but the child or the mother needs to also be healthy and their bodies need to be able to absorb those nutrients. At a more underlying level, causes of malnutrition include things like household food insecurity, which we heard a lot from Congressman McGovern. Also, inadequate care and feeding practices for children, like suboptimal breastfeeding, which I'll talk a little bit more about, unhealthy household and surrounding environments like poor water and sanitation, and inaccessible or inadequate health care. So there are multifactorial reasons for malnutrition, the most immediate around intake and absorption, and then the more underlying. And at its most basic cause, poor nutrition is caused, as you heard again in the Yemen video by that heroic nurse, by poverty. It's caused by societal, economic, and political factors. And those factors have a long-term influence on maternal and childhood undernutrition. And in fact, you can think of it, unfortunately, as a vicious cycle where chronic undernutrition leads to poverty, poverty leads to chronic undernutrition. And this is a cycle that we must break. Who are the most vulnerable? The most vulnerable from a nutrition perspective are women of reproductive age, so those especially that are pregnant and lactating because of the nutritional requirements that they need to stay healthy and have a healthy outcome to their birth, and children under 5. We saw in the Yemen video an example of wasting, which is essentially when a child's weight is too low for their height. There are other manifestations of malnutrition, and my point here is not to overload you with terminology, but it's really to make it clear that what you saw, that kind of very typical picture of malnutrition, isn't always what malnutrition looks like. There are more kind of insidious and hidden forms of malnutrition that are less obvious to the eye. One of which you may have heard of is called stunting, which is chronic malnutrition. And that's essentially when a child's height is too low for their age. There's an amalgamation called underweight, which Skye Fitzgerald also referenced in his video in Yemen. There are also micronutrient deficiencies like vitamin A, zinc, iron. These are often called hidden hunger, again, because we just don't see them, but their impacts can be lifelong. And typically those kind of micronutrient deficiencies happen when a diet is low in quality. So really, we do tend to focus on women of reproductive age, those especially that are pregnant, lactating, and children under 5, because they require the most nutrition. They also are going through different kind of growth cycles that are incredibly important. And one of those, the one that we actually have an organization with the name in their title, the 1,000 days. The 1,000 days is a period of time that we very much focus on in the nutrition world in terms of intervention, because there is just exponential growth, and that's also when the brain is wired. The 1,000 days starts with a woman during her pregnancy and goes to a child's second birthday. And this is the time when there, as I mentioned, is a whole host of fetal growth, brain development, when the immune system is being strengthened. There's the highest chance of mortality in the neonatal years. This is also the time when we can make the most difference, and our interventions, have the most ability to impact. So we often focus on this time period called the 1,000 days, and we do so because of the impact we can make, and also because some of the impacts, if we don't intervene, are absolutely irreversible. So before the COVID-19 pandemic, many families and communities struggled to provide children with good nutrition necessary for physical and mental development. 1 in 3 children were malnourished, and a far higher proportion of those children in the world's most kind of poorest and most fragile and dangerous places. Undernutrition is actually linked to 45% of all child deaths under the age of 5. And just to give you a bit more of a sense of the scope, pre-pandemic, about 1 in 5 children were chronically malnourished, while 47 million were wasted, so the manifestation that you saw in Yemen. And about 800,000 deaths a year are caused by a suboptimal breastfeeding. So that, as I'll talk to a little bit more later, is an extremely effective intervention that we know how to scale up and support globally. However, despite these statistics, we've actually made tremendous progress in the past decades to address malnutrition. We know, for example, that a child born at the start of 2020 was less likely to be malnourished than a child born in 2000. The number of chronically malnourished children decreased by 10% from 2012 to 2018. These are massive accomplishments done in part by many of the fantastic programs supported by the US government. However, COVID-19 really threatens to erase that progress. So why is malnutrition important? There's the obvious issues around health and mortality that we know, but it actually has much broader societal impacts. We know, for example, on education, that an undernourished child finds it harder to learn and therefore does less well in school than their better nourished counterparts. We know health, obviously just basic survival, but even more than survival, it's also about thriving. Early childhood undernutrition takes a toll later in life. Later in life, individuals who were malnourished in their childhood often suffer from more non-communicable diseases like heart and kidney disease, obesity, and diabetes. We also know that malnourished children grow up to be adults who are affected adults affected by undernutrition when they were little throughout their lives actually earn about 20% less than their well-nourished counterparts. And that's through a range of mechanisms, through anemia, stunting, so on and so forth. So those are more at an individual level, the impacts. At a societal level, you can imagine that these are all kind of exponentially magnified, but we also know at a societal and country level that the GDP of countries is reduced by 2 to 3% by malnutrition, and that's a massive loss in terms of dollars per year. And lastly, we know that nutrition is incredibly important for security and stability. We saw food price riots in 2008 in countries where there was massive food insecurity. So we know that nutrition affects all of these areas of development and is incredibly important to invest in. And we think it's important to invest in for lots of reasons. But if you just look at this from an economic argument, we know the return on investment for nutrition interventions is one of the best buys of global development. This is proven over and over again by leading economists engaged in the Copenhagen Consensus and other analyses. But basically, nutrition interventions are always ranked among the very best investments. And we have evidence to suggest that $1 invested in nutrition yields up to $166 in economic returns. And those returns are through all of those different domains that I just mentioned in terms of the impacts at basic human level and society levels. We also know that these return on investments, that we need to be doing much more. So despite the need, despite the return on investment, despite knowing that knowing what to do to address malnutrition, the United States and other donors still invest less than 1% of official development assistance into nutrition programs. Global nutrition lags significantly behind the US investment in other global health areas. So investing in global nutrition is not only key to mitigating COVID-19 around the world, but it also has enormous long-term benefits. And hopefully some of what I shared with you resonates. So let's talk a little bit about the COVID-19 impacts and the pandemic. So, and this, a lot of my data for this comes from the Standing Together for Nutrition Consortium. It's a consortium that was formed early in the pandemic by a group of researchers, academics, practitioners to come together and make sure that nutrition was not lost. And their work has been absolutely instrumental in terms of hopefully convincing you all that we must invest in nutrition. So COVID-19, they have done quite a bit of modeling work to estimate impacts on nutrition. One way to think about the pandemic is that it's really three pandemics in one. First, there's an economic crisis, and this crisis has led to job losses, income loss, reduction in GDP. We heard a little bit about this from Jenny and others already. We know that economic contractions, food supply disruptions contribute to household food insecurity. We know that up to 150 million people will become poor in 2020. Second, a food system crisis has disrupted food supplies, limited the availability of food in markets, especially nutritious foods, and food prices have increased across the board. So this is really important for nutrition because often when there's disruptions in supply chains, when there's less money at the household level, we tend to buy more inferior food products. So for example, coping strategies might be to shift to cheaper sources of calories. And this is really important for micronutrient malnutrition and other forms of malnutrition that I've mentioned. These dietary changes will lead to poorer quality diets and will encourage undernutrition and micronutrient deficiencies. The third kind of real crisis that we're looking at is a health crisis with this pandemic. And that's related to lockdowns that have limited access to health and nutrition services, and health resources have been diverted from frontline prevention to the treatment of COVID-19. So we know that because of lockdowns, that access to health services have been incredibly limited. Some countries, something as routine as immunization that runs quite well in many countries. 70% of countries surveyed in 105 countries from the World Health Organization reported disruptions in routine immunization. And I use that as a proxy because that's something that is typically very well institutionalized in countries. So if that's what's happening to routine immunization, we can only imagine what's happening to nutrition services, which are not as well integrated oftentimes into the health system. We also know from Ebola and other examples of previous pandemics that it takes a while for health systems to respond. It took about a year for healthcare to kind of recover in the Ebola situation. So we know that it will take time for health systems to recover from the COVID-19 impacts. So in terms of actual numbers, and I'm sorry to share, a range of numbers with you, and my intent again is not to overwhelm you, but to really give you a sense of what we're looking at and the urgency of the situation. The Standing Together for Nutrition Consortium just recently put out a paper in Nature Foods, and the preprint predicts, based on modeling, both conservative and less conservative, that an additional 168,000 children under 5 will die due to malnutrition. 9.3 million more children will suffer wasting. That's a 20% increase on existing rates. That's the form of malnutrition we saw in the Yemen video. And 2.6 million more children will be chronically malnourished or stunted. The pandemic also affects maternal nutrition. And as you heard me say before, maternal nutrition is incredibly important because a well-nourished mother has a well-nourished baby. And if we compromise on maternal nutrition, those birth outcomes are compromised. 2.1 million more women will be affected by maternal anemia, and that can result in difficult pregnancies. So there's big impacts on maternal, on infant, and this really then creates this intergenerational cycle of malnutrition, unfortunately. If we don't invest in these, in nutrition at this stage, we also, the Standing Together for Nutrition Consortium predicts that $30 billion will be lost in future productivity. And lastly, that the nutrition crisis will really impact lower and middle income countries, not for just a year, but for 3 years and beyond at a minimum. So what do? Most importantly, we invest in nutrition. It works. We know what to do. It is one of the best returns on our investment, and it can be a catalyst to all other investments in health, education, productivity. We also know, unfortunately, that nutrition has long been underfinanced. An additional $1.2 billion per year is estimated to be needed on top of the World Bank's kind of normative estimates of $7 billion per year to achieve the Sustainable Development Goals and World Health Assembly nutrition targets for 2025. So we've already been underfinanced, and now that we're faced by this pandemic, it's even more dire. We know interventions work. We have a range of nutrition interventions on the curative side that you heard about in the Yemen video, on the preventative side, and I'll give you an example. The protection and promotion of breastfeeding is one of the most important things we can do in nutrition. We can save 800,000 lives alone by breastfeeding, by optimal breastfeeding and supporting this. So what does this look like during the pandemic? Well, we know that interpersonal communication and support to women is critically important to having good breastfeeding practices. So while we can't at this stage and couldn't go, and have kind of more interpersonal connections as we once would have, we've actually shifted a lot to technology similar to this venue today. So we use a lot more mobile phones. We do advocacy and national events on online conferencing. We use SMS when we can. We do national campaigns using mass media. And there's some upsides to this. It's more democratic. More people can engage sometimes, in these efforts because of this. So there, are still special strategies needed for those most at risk, but the pandemic has also led to some innovation in programming. It's also allowed us to kind of harness lessons from the past. So with the pandemic, we really looked at HIV, knowing that there would be misinformation about breastfeeding and knowing that we would really need to make sure that national guidelines were accurate, that it is, for example, safe to breastfeed and how that works in the COVID-19 scenario. There's also opportunities, frankly, to just really leapfrog over a lot of things that have been stuck for a long time. Another example, many countries do iron folate acid, and that is something that's given to pregnant women. We know that there's an alternative, multiple micronutrient supplements that are extremely effective, but there are oftentimes the national guidelines have not been adapted to include MMS, multiple micronutrient supplements. This may present an opportunity where there are, frankly, disruptions in the health system where people are more open to innovation and to basically jumping over years of kind of bureaucratic hurdles to implement a new policy. So there are, I think, some real opportunities in the pandemic to really innovate and to move and surge ahead, frankly. Other examples of strategies that we know have happened include mobile medical teams, as I mentioned, campaigns, task shifting, home delivery of food and supplements, support for patients with transport and financial support, strengthening community outreach. So we do, I think, both know what to do, and also we're getting much better about how to deliver these interventions in the COVID-19 pandemic and also post-COVID-19. And hopefully some of these interventions will really, and some of these innovations will help us in years to come. So bottom line, we have to act now. Children are dying, as you saw in the Yemen video, and this will continue to happen. It's an ethical remit. I think it's an economic remit. It is a human remit that we must act now. We will lose time and we will lose a whole generation. Damage that cannot be undone. We have to reinvigorate efforts to safeguard good nutrition we know that nutrition benefits that they confer to the generation now and those in the future. And I know collectively we can mitigate the impacts of the pandemic. The costs, frankly, on the human and economic side are just too high not to. Thank you.
Thank you so much for those comments, Karin, and for really breaking down a very complicated issue, but at its heart is not complicated. We need to focus on nutrition and invest in it now. Now we're going to turn to Asma Lateef, who is the director for the Bread for the World Institute. Asma oversees the Institute's research, analysis, and education on policy issues related to U.S. and global hunger, malnutrition, and poverty. She currently serves on the steering committee of the Scaling Up Nutrition Movement Civil Society Network and is a member of the executive committee of the 1,000 Days Advocacy Working Group. Asma, over to you.
Thank you very much for having me today and for convening this really important session. We've heard such powerful remarks from Congressman McGovern, and the video couldn't have made the challenges we face more real. So I will focus. Karin's given us a really great overview of why nutrition is really important and some of the long-term consequences for if we neglect malnutrition. I will really focus my remarks on the importance of country leadership and US leadership at this urgent time. As you know, I'll start with sort of pre-COVID context and then move into you know, the long-term challenges we face now, and then where US leadership can really have an impact. So about 12 years ago, the international community really acted quickly on new evidence that was coming out in the Lancet, the UK medical journal, The Lancet, that really was bringing together vital evidence about the long-term consequences of malnutrition. At that time, it was really a galvanizing to the international community, and the United States played a really important role at that time in educating people about this new evidence. I should also say that a lot of that evidence was based on years of US investment in research in the science of nutrition and building you know, the capacity of countries to really measure and capture the quality of interventions. So we knew a lot 10, 15 years ago about what works, and Karin's presentation has really brought some of that to light. So the United States over the last 12 years has really done a lot to bring that evidence and use its diplomacy and its advocacy in educating leaders in countries all over the world, specifically finance ministers and other decision makers in countries that were most affected by malnutrition, especially malnutrition amongst mothers and children. And what we've seen actually in the last 10 years is really very exciting. We've got 61 countries that have really understood that malnutrition, especially in early childhood, has long-term consequences for their long-term development goals, and have created over the last 10 years, first of all, they've joined the Scaling Up Nutrition movement, and as part of that, they have developed national strategies to address malnutrition. And the United States, through USAID and through the leadership of various government agencies, have really supported that effort at the country level. The US government itself has taken some really important steps to improve its own effectiveness in the nutrition space. It's developed a whole of government nutrition coordination plan. USAID also has a multi-sectoral nutrition strategy that brings together the health sector, the food security sector and other parts of the agency, the humanitarian sector. There's also now a Nutrition Leadership Council that's, bringing the key decision makers in those sectors together to really coordinate and collaborate in the way they are supporting countries. And we'll hear later from the Chief Nutritionist at USAID. That's a new position that's been created that also helps make sure that everyone is working in the same direction. So these are really important innovations, and we've seen some impact. I think Karin pointed out that we've seen reductions in stunting, quite dramatic reductions in stunting in a very short period of time. In some countries, really significant reductions. And we've also seen strong bipartisan congressional support for nutrition, including in terms of increased funding. These are all really important. This is all really important progress. And, the COVID-19 crisis is clearly testing all these systems in very direct and real ways. And how we respond to this crisis now will really be important for the future. And Karin very nicely laid out some of what's at stake and some of the opportunities. So I'll just really mention a couple of things. The UN agencies came together last summer and estimated that there's a real funding shortfall of about $2.4 billion. That was a minimum that they estimated that was needed to protect children, prevent and treat malnutrition, and avoid child mortality. That's an estimate of what's needed right now in this crisis. And urgent, we've been discussing a lot the long-term consequences of this. We should really be mindful that what will happen to children that are born in this period, during this time of COVID, this is going to affect them for the rest of their lives. And these costs to them individually and personally, if they survive the malnutrition, really will affect their trajectory. It will rob them of their potential. And so it is really time for us to act, as everyone has said. And US leadership is really important now because we have donors in many parts of the world that are either stepping away from this space or unable to lead. And I think it's really, the US is in a position now where its leadership, because of its historic leadership and because of our understanding that all our investments in other areas are undermined by malnutrition, the growing malnutrition as a result of COVID, and that the short-term crisis will become a long-term crisis. US leadership will be really crucial in this coming year because of the events that Jenny mentioned, but also because when the US leads, we know this time and time again, when the US leads, other donors, other partners follow, and that is really crucial at this stage. And so, as we think about the investments we need to make now in terms of addressing the COVID crisis, this is really a key area to invest so that we don't pay the price for this over the long term. I'll stop there and I'll look forward to the discussion later.
Thank you so much, Asma. And now, last but not least, we turn to our final speaker, Shawn Baker, who is the Chief Nutritionist at the U.S. Agency for International Development. In this position, Shawn chairs the agency's Nutrition Leadership Council, oversees the vision and strategy of the agency's Center for Nutrition in the Bureau of Resilience and Food Security, and coordinates related efforts across the agency. He also guides USAID's investments and engagement with partners to address malnutrition in developing countries. Shawn has decades of experience in public health, nutrition, and food security. And over to you, Shawn, for your remarks. Thanks for joining us.
Thanks so much, Jenny, for those warm remarks, and a huge thanks to Interaction, Bread for the World, and 1,000 Days to pulling together this incredibly important conversation. I also was incredibly energized by Representative McGovern's opening remarks that he shared with us via video, and I think he and his co-chair on the House Hunger Caucus, Representative Walorski, represent exactly the incredible long-term bipartisan leadership in the U.S. that has been so instrumental in providing USAID the resources necessary to tackle undernutrition and to provide the leadership that has not just directly funded programs, but helped shape the way others fund nutrition programs. Karin and Asma have really set out many of the stakes incredibly well. And if I was going to summarize in 5 points some of the things that have been said, I would start with undernutrition. 45% of under 5 mortality, and those kids who survive malnutrition, we have fundamentally compromised their futures, their cognitive and physical development. To add to that, you often have huge problems in the world for which you do not have solutions. Malnutrition is a huge problem for which we have a number of cost-effective, scalable solutions, such as the ones that have been discussed. That leads to the third point of they are some of the most cost-effective solutions in development, period. Also, we often talk about how much damage is done in that 1,000-day window for pregnant and lactating moms and infants and young kids. I'm an optimist, and I turn it on its head because we also know if we actually provide good nutrition for moms and kids in that 1,000-day window, we have locked in their ability to survive and to thrive, and that is irreversible potential that we've brought to the world. And as others have stressed now here, this is not something that can wait. Every day of inaction means that more lives are lost and kids are born malnourished or go through malnutrition, and if they survive, their futures are compromised. Now, we've heard a lot of grim statistics about the magnitude of the problem, some of the solutions. I would also like to turn to some of the things in the past year, which is a year unlike any of us have probably ever seen or hope to see again, but some things that really give me hope and that my optimism is not totally delusional, but there's an evidence base for it. The first, I'll come back to the leadership. 2020 was bookended by 2 very important events, and Asma signaled them. The day I got my final word on coming to USAID in this position was the day that the Senate passed a unanimous resolution recognizing US government leadership in ending maternal and child malnutrition and supporting USAID's multi-sectoral nutrition strategy. And then just before the launch of the Year of Action for Nutrition for Growth in December of last year, so I think it was on the 7th of December, but Asma will correct me if I got the date wrong, that same resolution was passed unanimously by the House. Again, this level of consistent commitment is important, not just for the own resources, but a signal to the world of how important nutrition is. Asma has also pointed out, I think, some things that have happened internally at USAID that, in fact, model the behavior that we want our partner governments to have, which is to bring the different parts of the system that need to deliver good nutrition across health, across agriculture and food systems, and across humanitarian response together to elevate and prioritize nutrition. Now, little did I think when I would step into this role as Chief Nutritionist and have the privilege of chairing our internal Nutrition Leadership Council that I'd be facing this year. But I think on the positive, it's really pressure tested. Was USAID positioned to rise to the challenge? And I think the ability to have our leaders across all of our bureaus, from the top leadership of the agency both support internal and external actions on nutrition, I think really showed that when we act together and mobilize our resources, we can have an impact, elevate the questions of nutrition and its importance for survival and development to the highest political levels of our partner agencies and internally. The fourth is also beyond USAID, as Asma has reflected on, incredibly energized by the Global Nutrition Coordination Plan, which now includes 10 departments and agencies across the US government. Each one has nominated a senior nutrition champion internally, and incredibly energized about the nutrition agenda and how we as US government can really lead because of our incredible expertise, our convening authority, and the way we work with partner governments and a multitude of agencies, a multitude of institutions across the US, universities, civil society, etc. The fifth, and perhaps the most profound, although we certainly have, most of us have been deprived of the field visits, such as what Representative McGovern referred to, which are the lifeblood of getting us energized, we have been able to have an incredible amount of information coming from the field with our partner governments, implementing partners. And Karin, you referred to some of these, and I think it goes back to the challenge that Representative McGovern gave to us of reimagining nutrition. And we've just seen this incredible innovation, reimagining of, even in light of the constraints posed by the pandemics, the increased needs posed by the pandemic, the tenacity, innovation, and passion of our partners to keep things going, finding new ways of doing work, has just been, to me, the most inspirational part of 2020. And I think that's because there have been decades of investment of the US government with our partners, our partner governments, that basic infrastructure to deliver on nutrition is there and weathered actually the pandemic and is ready to respond to the increased needs. Also, and Jenny, you started out, I thank you very much, of looking forward, because I really see this year as really a make or break year for nutrition for reasons you've laid out, but I'll go a bit more into detail on why, as I think Asma has said, the US government, which has historically been such an incredible leader, I'd say not just the US government, but all of the US government, academic institutions, civil society organizations, because even the current scenario of funding of nutrition got a boost in the arm back in 2013 with the first ever Nutrition for Growth Summit. Prior to 2013, donor funding to nutrition, speaking about some of the interventions that Karin was speaking about, was still under $400 million a year. And it was really the first concerted effort to get more serious about financing for nutrition, which bumped it up to about $1 billion a year and is hovering around $1 billion or more. But most of those commitments ended last year. Everyone is facing, of course, constraints, and we have increased needs. But we have this year huge opportunities to shape the global agenda and bring the global and national agendas together with, as you said, the UN Food System Summit and the Year of Action of Nutrition for Growth, which will be capped in that capstone event in Tokyo in 2021, where US leadership, we can work with our partner governments, other donor organizations, private sector enterprise, civil society, and foundations to re-energize and recommit to the agenda. The last point, and others have said this, but during the pandemic, again, I will go back to trying to be optimistic, of every system we rely on to deliver good nutrition has been pressure tested: the health system, the food system, social protection programs. And as we support rebuilding these systems, we know exactly which points need to be strengthened to ensure they're providing good nutrition, particularly focused on good nutrition for moms and kids. And so We've learned massively, and I think we know we're so much better positioned to rise to the challenge now than we've ever been. And we're extremely grateful at USAID for the resources that appropriators have consistently provided, and that strength of bipartisan support and leadership for nutrition is invaluable. Others have referred to that the US government has part of different commitments, including commitments on targets for the World Health Assembly on nutrition, the Sustainable Development Goal, has really made joined some major promises on reaching nutrition targets for all the reasons we've laid out here. And I was reflecting going forward of the challenge I think all of us face going into this year. On this path to nutrition for growth back in 2017, there was a global nutrition summit in Milan, and I had one of the greatest privileges of my lifetime of moderating a panel where Mrs. Graça Michel was speaking, and she closed out the commitment ceremony, and she started by referring to those promises and said, as a mother and a grandmother, what you learn is you can never break a promise to a child. And I think, we have promised to resolve mother and child undernutrition. We know the magnitude of the problem. We have the tools to do it. And I think part of what we all aspire to is to actually keep those promises to kids across the world, because we know it's possible, we know it saves lives, and that we know it ensures their future. So I really look forward to you to continue to work with partners like Interaction, 1,000 Days, Bread for the World as we move forward with our leadership in Congress, Representatives McGovern and Walorski, and partners across the US government as we go into this really make or break year of action, Nutrition for Growth. So thank you very much, Jenny.
Thank you, Shawn. That was a perfect summary and pulling together all of the things that we have heard here today. Really thank you for your remarks and your leadership. And at this point, we've heard such great remarks today. We have run out of time to take questions. So I just want to close this by saying thank you to Representative McGovern, Skye, Karin, Asma, and Shawn for your leadership on these issues and for taking the time to talk with us here today. It's clear we have a lot of work to do, but the good news, as we heard from all of you, is we know how to do it, but we need the resources to do it. And as I mentioned at the beginning, that's why the NGO community is asking for $20 billion in supplemental funds to help address this crisis. And as Representative McGovern said, and as our speakers made very clear, it's not just the right thing to do, and it is the right thing to do, but it's the smart thing to do. So thank you, everyone, for joining us today, and we look forward to continuing this important conversation with all of you in the weeks and months to come. Have a good day.